Someone once said that health is everything. And I don't know if you agree with that or not, but certainly it is critical to being able to function. And for clergy within our United Methodist connection to be able to handle the pressures and the demands of leadership, to engender the support of congregation and community, requires that they be fit and healthy in all areas of their lives. And in fact, that is essential to the future mission of this denomination. Some years ago, we recognized that all was not well with our clergy. Our data, we manage a health plan, the Health Flex plan. It covers about half the conferences in the connection, and we see aggregate data coming through. We also conducted a survey across other conferences and their health information, and we saw that over the last few decades, some alarming trends have been growing, especially that clergy and clergy in other mainline denominations show higher diagnosis rates across some areas than the general population. We have higher diagnosis rates for illnesses like stress-related illnesses, which can include mental nervous illnesses. We have a higher incidence of overweight and obesity. We have a higher incidence of diabetes. I am happy to say we have a lower incidence of substance abuse-related illnesses, but we began to see a trend that called our attention to trying to say what is happening here and how is that going to affect the mission and ministry of the church, to say nothing of the clergy themselves. So after completing the research necessary, we submitted a petition. We actually had a denominational health task force that looked at this research, satisfied itself that in fact this was provable and true, and it was across the connection. And then this group submitted a petition to General Conference that it was approved at the 2008 General Conference. That General Conference then directed these two agencies to work together to sponsor a task force to examine the itineracy and the appointment-making systems and recommend improvements that support clergy health, examine and recommend improvements in supervisory systems, address processes for entering and exiting ordained and licensed ministry, and provide guidelines for sustaining a healthy work-life balance during ministry.